This is a segment I'm calling Woman to Woman with Dr. Seth Stabinsky, who's going to help all the women out there from something that a lot of women suffer from, and that is heavy bleeding. Right, Dr. Seth?
That's absolutely right. In fact, about 1 in 5 women suffer from menorrhagia, what we call menorrhagia, which is heavy or prolonged uterine bleeding each month.
Okay, when you say heavy bleeding, what does that mean? Does that mean a period that lasts for a long time, or does that mean heavy during your cycle?
That's a really good question, and in fact, all women are a little bit different, and sometimes it's just really heavy bleeding for 5-6 days, and other times it can be really going through the whole month and very irregular bleeding with lots of heavy flow and clots that keep people at home and they can't even go out to work.
I know a lot of women. I could have like 5 friends and we could sit there over coffee or whatever and talk about this problem.
I think there are a lot of women out there that think this is just normal, that their mothers and sisters bled this way, and we really have a way to be able to take care of that.
So what do people do about this?
Typically what's often done is hormonal therapy, but women often don't really want to be on hormones. There's an IUD available to treat it, and when we get into more drastic kinds of treatments, even hysterectomy is offered for this. And what we offer at our center at EasyGYN in San Jose is we offer the opportunity for women to have a minimally invasive treatment that permanently treats the problem.
Okay, so you talked about different procedures on how to treat this, and some of them are pretty invasive, but this NovaSure is completely different.
That's correct. We don't want women to have to go to the hospital and have an operative procedure when it can be done in the office. NovaSure can be done in about 90 seconds or so. The procedure itself takes that long. People are usually in and out of the office within about a half an hour.
Okay, so I had 2 friends last year that had hysterectomies for the same problem, and so they could have probably done something like this.
Generally, the procedure's not really recommended for women that have not finished their childbearing yet. And also, if they've got large uterine fibroids, it may not be workable. But we have some other treatments for small uterine intracavitary fibroids and polyps, and sometimes even the NovaSure procedure can be used for that. There's about 200,000 hysterectomies performed every year in the United States for women with completely normal uteri. Those women would be able to avoid hysterectomy if they had a procedure like this done.
So what kind of a procedure is NovaSure?
Well, NovaSure is a minimally invasive procedure, and by that we mean everything we do here is minimally invasive. Patients get a little bit of sedation, either oral or intravenous, and they get local anesthetic, and they're very comfortable with the procedures that we do. We want to make sure nobody leaves here uncomfortable or saying that, gee, that really hurt. We want it to be comfortable. Otherwise, they may as well be in the operating room. So NovaSure, we basically block the nerves to the cervix and put a small catheter inside the uterine cavity, open up a fan that has a metallic array on it and is able to deliver electrical energy to the uterine cavity and destroy the lining of the uterus. Typically, patients are in and out the door within about 30 to 45 minutes.
And what happens after that, the recovery time?
Recovery time is typically a few days. The patients are a little bit crampy, a little bit uncomfortable for a few days. They're really back to their usual activity within a few days.
Who should do this procedure?
Well, the procedure is really designed for women who have completed their childbearing, that are definitely done having children. You don't want to have children after an ablation. Basically, women that are uncomfortable with the amount of bleeding that they're doing. If women are bleeding to a point where it's interfering with their activities of daily life, where they can't go to work or they can't take care of their children adequately, or, for example, they might be having really bad cramps or even PMS symptoms. When we remove the lining of the uterus with this procedure, it's a permanent removal, and also we're removing the area of the uterine cavity that actually produces the hormone that causes PMS kinds of symptoms and painful periods as well.
Is this an expensive kind of procedure?
When a hysterectomy is done, for example, that's going to probably cost upwards of $10,000, and we can cut that by probably 2/3 by doing a procedure like this in the office. Most major insurers cover the NovaSure procedure. Even Medi-Cal covers NovaSure, and I'm glad to say they're actually going to cover a sterilization procedure that we do in the office soon.
So if you're a woman who suffers from heavy bleeding, or from what I have just learned, menorrhagia, right?
That's correct.
All right, you can call Dr. Seth and learn more about that, and also about NovaSure, right?
Absolutely. Just give us a call at 888-844-8555, and we're actually in the office often on evenings and weekends, and so tonight we're actually in the office, and I'll take your phone calls tonight.
All right, and then next time we're actually going to talk to someone who had NovaSure done, the procedure, so we can find out what it was like for her.
That sounds great.
All right, thanks, Dr. Seth.
Good.
See you next time.
For more information on EasyGYN in San Jose, call Dr. Stabinsky at 888-844-8555 or log on to the website at easygyn.com.